Right, here we go. So, hey, welcome guys, and thanks for joining us on the live stream. And yeah, look, I wanted to, it's interesting actually, I'm having a real interesting time coming up with subjects each day because, it's one thing to say, right, I'm going to do every day, weekday, presentation, but actually finding the things that are most thing. And I'm trying to sort of, if you like, develop my knowledge and also develop, your knowledge, if you like, as we go through. And really give a balanced opinion of what I think as an investor, because I think one of the key things that most people miss is that, and I talk about this and I'll show you the thing, but, there's the human side of everything, there's the medical side, and then there's the economic side. And generally I don't get involved in the medicine, but I've kind of had to get involved in the medicine because if you understand that, you can then understand the economics and the potential, ups and downs and all that for the economic side. But, the human side, I think we all understand, which is, people are dying, people are going into hospital, there's fear, people are being made redundant, people are, and so there's all this sort of stuff, which has obviously an economic and a health thing potentially, and it's, it's a pretty scary time. But I think the big thing is that if you can keep focused on the positive, and hopefully that's what, I think part of being positive is not necessarily, just focusing on all the good news, but it's also, having a broad range of news that you feel confident in, and that gives you a bit of certainty, even if there is a lot of uncertainty out there. But look, today what I want to do is, look at which country has the best model for dealing with coronavirus. And I'll say up front, there is no country that has the best model, because if you look at the numbers of deaths, it's not very good, news. I mean, we can say, well, that country's had the least deaths and this country's had the most testing and all this sort of stuff. So we can look at certain metrics, but I don't think there is one country that has quite got it all under control. But actually, what we're finding now is there's a convergence of all of the countries are heading in the same thing. Even the US is being forced to toe the line. As much as, Trump was totally incompetent, they are now really starting to have to get there. Guys, just while I'm here too, if you've got any questions while you're watching, pump them into the or if you're watching from YouTube, put them into the YouTube comments and I can answer them while we're going through. Otherwise, I'll deal with them, and I'm recording videos. I think I did 4 or 5, 6 videos yesterday, and I'm sort of pumping up that, really. But yeah, any questions you've got, happy to answer them, happy to give my opinion. I'm not a doctor, but what I do is I sort of sit and I read and I listen to a lot, and then I look at what I know from previous and try and bring that into, give you some certainty effectively. So let's get started anyway. So look, today's topic is, which country has the best model for dealing with coronavirus? And look, we're back into, it's actually halfway through the 30 days. So I started these, if you like, 15 days ago. And I said, right, we're 30 days before the lockdown restrictions start to ease off. And if you look at the UK, they put a 3-week lockdown in 3 days earlier than, 3 days after I said. But basically, look, they're saying 12 days. I'm not sure it's going to be 12 days. I think we're into the thick of it now in terms of rising thing. I think 75 days before the real lifestyle impact where we get back to normal things. And Wuhan was, less than 90 days as well. So I'm using that model and various other models, to see sort of where we're at. In terms of where we're at, we're at 860,000 cases. But the amazing thing is, if you look, 786,000 the day before, and now 860, America really is getting hit hard. And we knew this was coming. We knew the arrogance of Trump and the rest of the politicians was, causing this. 75,000 cases. This is new cases, all right? It's full on out there. UK, 3,000 new cases. So, it's full on there. Now, the interesting thing with that is this is a concertina effect. So London has been hit first. And then the amazing thing is what will happen is London gets hit, and then it goes from London and concertina's out. And it's the same with the US. The US has New York and it concertina's out. And really, I think we may have caught it in the UK early enough for a lot of places, so they're not going to get absolutely slammed. I think the medical response is showing through now. So you've got we missed the initiative, okay? And I'll talk you through the models, but we missed the initiative. Now what we've got to do is we've got to get back on top of it, and we do that through mitigation, social distancing, all that sort of stuff, and I'll talk through that side. But yeah, it's an amazing thing right now with where we're at. I mean, if we come across to the Italy versus UK versus USA, it's interesting. For a long time, I've had USA in red because I didn't believe it. I thought they were full of crap. I put them back into black because I think now we're starting to get a much better idea of reporting, and they're actually starting to test now, whereas before they weren't testing. Okay, so I think they're starting to realise the seriousness of the situation, and that there's not really an option to just push through it and ignore the medical and do this herd mentality, which is what they started doing. In terms of, they did it for a lot longer, and so they're going to get hit a lot harder. They're saying 100 to 240,000 deaths, which is just phenomenal. But they have such massive community spread right now that it's incredible. So look, my framework, and I mentioned this yesterday, is the medical, the economic, and the human side. There's 3 sides to this thing, and each of them have to be treated differently. So let's look at the model that are working best, okay? And look, the first thing is with medical is early intervention. Those countries, Singapore, South Korea, Taiwan, a lot of these countries were into SARS, and they remember what happened then. So they already were prepared to do the things they need to do. So therefore they've got in early interventions. The business companies that go along, which is unfortunate. It seems everybody's just on the internet right now. So anyway, we'll see how we go. Hopefully we won't lose the stream totally. But yeah, so cleaning public services. Interestingly, with the cleaning public services, surfaces, that is to stop the spread. So it's all good to do everything we need to, but actually we need to potentially do even more than that. So that is the best model. And really, the Asian countries that had SARS are the ones that are doing better. But there is a convergence now on the medical, which is to say that most countries are heading towards the same thing, which is quite interesting. Cool. Okay, and what about the economics? So the economics, interestingly, whilst started out very differently, most countries are again converging. And again, early intervention. The last thing you want is uncertainty. Uncertainty in all your employers causes job losses. And I look at Australia, the job losses there are incredible. They've now been able to take them back. In fact, the UK, even they were probably a week slow, and therefore they're taking those back. So anyone from the 28th of February is able to ask for their job back from the redundancies, which is quite good. Keeping people in work, that is one of the key things, because that's going to allow it to bounce back. Supporting small businesses, that's going to allow us to bounce back quickly. Assisting people who are made redundant, maintaining the existing welfare system, making loans, grants, all this sort of stuff. This is the real key stuff that you need to do, and allowing mortgage payment holidays. That is key, yeah? And then the other information, regular updates, making sure they get, PPE equipment early, because that is key. Sorry guys, I realise we're just having heaps of issues with the streaming, which is unfortunate. I'll try and get on top of that tomorrow and work out how we can get it. I've got a 1 gigabit meg line, but unfortunately I think everything's slowed down now. But yeah, we may have to not do lives anymore. Anyway, we'll work this out. Look guys, so the key here is early, and early and recognise it. If you recognise it early enough, you get the equipment that's needed, you get the medical resources. I mean, you look at the hospital that's been set up, that's a medical response, but it's also a human response. If people know that these hospitals are being set up, the government's serious, they have more confidence in the government, and therefore they're more likely to take what they think. The Asian countries, again, that had SARS, they're more likely to listen to their governments, and the reality is their governments are reasonably transparent in most cases. And so that works in their favour. Whereas the European countries, maybe not so much. There's not the trust of governments. There's a bit of contempt. And the US certainly, that is. But I think the key is how you as an individual can work. And I think, look, the bottom line with that is, guarding your mental health. And this is what it comes. And I think the mental health, that word, often is associated to, crazy or, in a mental institution, that sort of stuff, which is the very extreme of it. What we're talking about is good health, wellness, low stress, that sort of thing. I used to work in mental health many, many years ago, and it was the clinical side of mental health. It was in the hospital side or the, pre-hospital. But bottom line is, things like, a daily routine, keep talking. So talk to your staff, talk to your employees, talk amongst yourselves if you're employed. All these sort of things really go to help. And what I'd say too is ignore the news. There is so much news out there that, in some ways, I'd even say, don't bother listening to my bloody thing, because it's even more news, unless it's of value, of course. But look, bottom line, set goals while you're there and reframe, your relationships with finances and all this sort of stuff. And if you do that, you're likely to come through. And I think one of the final things that I'll deal with is just this. When you're looking at stuff, what you've got to realize is this. Right now, we're seeing a rise in cases, a massive rise in cases. We're seeing deaths as well, okay? The deaths are from 2 to 3 weeks ago. The cases from 2 to 3 weeks ago. So we've got another 2 to 3 weeks of huge amount of cases getting added right now. The cases then become hospital admissions, and then admissions become deaths or recovery, okay? And so what we need to really look at, and what we're going to have to face on the negative side, is the cases are going through the roof, yeah? The hospital admissions are going to go through the roof. Then the deaths are going to go through the roof. But what will happen is the cases will start to drop off, but the deaths and hospital admissions will still go. Then the hospital admissions will drop off, and then finally the deaths will drop off. And when that starts to happen, that's when I think we'll start to see some relaxing of the lockdown and then what's going on. And I think really, that is key. And I think really if we can get to that and we can stay focused, stay positive, we will get through this, and we definitely will get through this. There's no doubt about that. But while you're in this, and I think we've probably got another 2 or 3 weeks potentially before we start seeing those deaths drop off. There's some good news now or already. It's starting to look okay. I mean, the numbers are still going up, but they're not jumping up as much. Even though the deaths yesterday, I think it was 389 deaths yesterday, they are jumping up. But that's a result of 2 to 3 weeks ago. And I think hopefully we can keep it at that level. The reality is I think the deaths are likely to go up, to be fair, and the cases and everything for probably the next, at least a week, if not 2 weeks, if not 3 weeks, depending on how well we did with the mitigation. But I'm hoping it'll be more that 1 or 2 weeks before we start to see it taper off a bit. But certainly I don't think it'll be a Italy type style thing or a Spanish type thing. I think it's more likely to be a Germany type thing. And that's where we are. But look, guys, the other thing is I've decided what I'm going to do is I'm going to change my frame of reference tomorrow, in that I'm going to focus on how many recoveries are happening, because I really want to bring the positivity in this, okay? So yes, we'll still record the other stuff, but actually I want to add in the recoveries, because I think that's going to be important, just to show how many people are actually getting through this. It's a tragedy, it's a human tragedy, as I mentioned, but the reality is there's also a human triumph, which is that people are getting through this, and potentially those antibodies that they're creating are able to help them through. All right, guys, thank you very much for listening, and yeah, we'll see you tomorrow. All right, see you guys.